NBC CBT questions and answers. Question number 151. What is the purpose of the NBC code? Option A. It outlines specific tasks or clinical procedures. Option B. It ascertains in detail a nurse's or midwife's clinical expertise. Option C. It is a tool for educating prospective nurses and midwives. The correct answer is option C. It is a tool for educating prospective nurses and midwives. Question number 152. Among the following values incorporated in NBC's 6 C's, which is not included? Option A. Care. Option B. Courage. Option C. Confidentiality. Option D. Communication. The correct answer is option C. Confidentiality. Questions number 153. Independent advocacy is: option A. Providing general advice. Option B. Making decisions for someone. Option C. Care and support work. Option D. Agreeing with everything a person says and doing anything a person asks you to do. Option E. None of the above. The correct answer is option E. None of the above. Question number 154. Which nursing delivery model is based on a production and efficiency model and stresses a task-oriented approach? Option A. Case management. Option B. Primary nursing. Option C. Differentiated practice. Option D. Functional method. The correct answer is option C. Differentiated practice. Question number 155. Essence of care benchmarking is a process of: option A. Comparing, sharing and developing practice in order to achieve and sustain best practice. Option B. Assess clinical area against best practice. Option C. Review achievement towards best practice. Option D. Consultation and patient involvement. The correct option is answer A. Comparing, sharing and developing practice in order to achieve and sustain best practice. Question number 156. How do you remove a negative pressure dressing? Option A. Remove pressure then detach dressing gently. Option B. Get TVN nurse to remove dressing. Option C. Remove in a quick fashion. The correct answer is option C. Remove in a quick fashion. Question number 157. The client reports nausea and constipation. Which of the following would be the priority nursing action? Option A. Complete an abdominal assessment. Option B. Administer an anti-nausea medication. Option C. Notify the physician. Option D. Collect a stool sample. The correct answer is option A. Complete an abdominal assessment. Question number 158. Approximately how long is the spinal cord in an adult? Option A. 30 centimeters. Option B. 45 centimeters. Option C. 60 centimeters. Option D. 120 centimeters. The correct answer is option B. 45 centimeters. Question number 159. The nurse should adjust the walker at which level to promote safety and stability? Option A. Knee. Option B. Hip. Option C. Chest. Option D. Armpit. The correct answer is option B. Hip. Question number 160. The client advanced his left crutch first followed by the right foot, then the right crutch followed by the left foot. What type of gait is the client using? Option A. Swing to gait. Option B. 3-point gait. Option C. 4-point gait. Option D. Swing through gait. The correct answer is option C. 4-point gait. Question number 161. Which law provides communication aid to patient with disability? Option A. Communication Act. Option B. Equality Act. Option C. Mental Capacity Act. Option D. Children and Family Act. The correct answer is option B. Equality Act. Question number 162. Anna has been told that unless she does what the ward staff tell her, the consultant will stop her family from visiting. What type of abuse is this? Option A, psychological abuse. Option B, discriminatory abuse. Option C, institutional abuse. Option D, neglect. The correct answer is option A, psychological abuse. Question number 163. The measurement and documentation of vital signs is expected for clients in a long-term facility. Which staff type would it be a priority to delegate these tasks to? Option A, practical nurse. Option B, registered nurse. Option C, nursing assistant. Option D, volunteer. The correct answer is option B, registered nurse. Question number 164. All should be seen in a good documentation except option A, legible handwriting. Option B, name and signature, position, date and time. Option C, abbreviations, jargon, meaningless phrases, irrelevant speculation and offensive subjective statements. Option D, A, correct, consistent, and factual data. The correct answer is option C, abbreviations, jargon, meaningless phrases, irrelevant speculation and offensive subjective statements. Question number 165. There have been several patient complaints that the staff members of the unit are disorganized and that no one seems to know what to do or when to do it. The staff members concur that they don't have a real sense of direction and guidance from their leader. Which type of leadership is this unit experiencing? Option A, autocratic. Option B, bureaucratic. Option C, laissez-faire. Option D, authoritarian. The correct answer is option C, laissez-faire. Question number 166. The famous 14 principles of management was first defined by option A, James Watt. Option B, Adam Smith. Option C, Henri Fayol. Option D, Elton Mayo. The correct answer is option C, Henri Fayol. Question number 167. A 23-year-old woman comes to the emergency room stating that she had been raped. Which of the following statements best describes the nurse's responsibility concerning written consent? Option A, the nurse should explain the procedure to the patient and ask her to sign the consent form. Option B, the nurse should verify that the consent form has been signed by the patient and that it is attached to her chart. Option C, the nurse should tell the physician that the patient agrees to have the examination. Option D, the nurse should verify that the patient or a family member has signed the consent form. The correct answer is option B, the nurse should verify that the consent form has been signed by the patient and that it is attached to her chart. Question number 168. Clinical benchmarking is option A, to improve standards in healthcare. Option B, a new initiate in healthcare system. Option C, a new set of rules for healthcare professionals. Option D, to provide a holistic approach to the patient. The correct answer is option A, to improve standards in healthcare. Question number 169. Wound care management plan should be done with what type of wound? Option A, complex wound. Option B, infected wound. Option C, any type of wound. The correct answer is option C, any type of wound. Question number 170. Wound proliferation starts after option A, 1 to 5 days. Option B, 3 to 24 days. Option C, 24 days. The correct answer is option B, 3 to 24 days. Question number 171. A patient developed pressure ulcer. The wound is round, extends to the dermis, is shallow, there is visible reddish to pinkish tissue. What stage is the pressure ulcer? Option A, stage 1. Option B, stage 2. Option C stage 3. Option D stage 4. The correct answer is option B stage 2. Question number 172. Which solution use minimum tissue damage while providing wound care? Option A hydrogen peroxide. Option B povidone iodine. Option C saline. Option D gentian violet. The correct answer is option C saline. Question number 173. What would make you suspect that a patient in your care had a urinary tract infection? Option A. The patient has spiked a temperature, has a raised white cell count, WCC, has new onset confusion and the urine in the catheter bag is cloudy. Option B. The doctor has requested a midstream urine specimen. Option C. The patient has a urinary catheter in situ and the patient's wife states that he seems more forgetful than usual. Option D. The patient has complained of frequency of fecal elimination and hasn't been drinking enough. The correct answer is option A. The patient has spiked a temperature, has a raised white cell count, WCC, has new onset confusion and the urine in the catheter bag is cloudy. Question number 174. What medications would most likely increase the risk for fall? Option A. Loop diuretic. Option B. Hypnotics. Option C. Beta blockers. Option D. NSAID. The correct answer is option B. Hypnotics. Question number 175. You are looking after a 75-year-old woman who had an abdominal hysterectomy 2 days ago. What would you do to reduce the risk of her developing a deep vein thrombosis, DVT? Option A. Give regular analgesia to ensure she has adequate pain relief so she can mobilize as soon as possible. Advise her not to cross her legs. Option B. Make sure that she is fitted with properly fitting anti-embolic stockings and that are removed daily. Option C. Ensure that she is wearing anti-embolic stockings and that she is prescribed prophylactic anticoagulation and is doing hourly limb exercises. Option D. Give adequate analgesia so she can mobilize to the chair with assistance. Give subcutaneous low molecular weight heparin as prescribed. Make sure that she is wearing anti-embolic stockings. The correct answer is option D. Give adequate analgesia so she can mobilize to the chair with assistance. Give subcutaneous low molecular weight heparin as prescribed. Make sure that she is wearing anti-embolic stockings.